So hi everybody, my name is Anita Ramsetty. I'm one of the endocrinologists that works at Englewood Hospital. Anita Ramsetty, last name, yep. So I work at Englewood Hospital and I'm an endocrinologist as a specialty, so much of what I do is taking care of people who have diabetes and other hormonal type conditions. So the talk tonight is really going to be about not diabetes itself, but about weight. And I know you guys are in the weight optimization program and talking about some of the things that might trip you up, so we can go over, and you can ask questions as we go through to see sort of how you feel about some of the information. Some of it may surprise you a bit, so we'll see what we get to. One of the first questions I often get from a lot of patients is why weight loss slows down. So I don't know if any of you have tried to lose weight in the past and it was going great, and then all of a sudden you couldn't lose any more weight. That's pretty typical. So oftentimes what happens is people start a new diet or they'll start a new exercise and they'll lose 5 pounds, 7 pounds, something, and they think it's going really, really well, and then all of a sudden they stop there. And no matter, they're doing the same thing, but they're not losing any more weight. That's actually a normal thing. So if you think about it, your body is meant to hold on to weight. There's no reason for it to lose the weight. If you're losing weight, your body thinks something is wrong. Biologically, we're meant to hold on to our weight. It's supposed to keep you alive. And so if you're starting to lose weight, your body starts to put hormones that do the opposite and try to get you to gain the weight back. That's a normal thing. So it's not that you've done something wrong or the exercise isn't working the way it's supposed to. Everything's doing what it actually is supposed to do. When you start losing weight, your body tells you something is wrong and it tries to regain it for you. It thinks it's doing you a favor. And that's what makes it so frustrating, is that you're doing everything right, but the results aren't quite what you want. And it's very frustrating. You've done all of these different things and all of a sudden the weight loss isn't working. Rest assured, this is actually your body doing normal things. For instance, one of the hormones that we make is called ghrelin. It's the one that makes you feel hungry. When you start to lose weight, that hormone starts to go up. It actually makes you hungrier as you start to lose weight. That's normal. And that's your body telling you, you need to eat more. You've been losing weight. So I'm telling you this so that you can sort of understand if you're on a weight loss journey now or at some point in future, and you start getting frustrated with, I've been doing all this stuff they told me, and it worked for a while, and now it's not working. That's normal. That's your body actually doing what it's supposed to. The trick is getting over that hump. And typically what that means is you need to kick into like phase 2 of what you need to do, and you change your diet again or you change your exercise again to get over that hump. And that's where I always have to tell my own patients, I'm like, you've done a great job so far. Now your body is trying to get you back to where you were, so you need to kick it up another level so that you get past this corner. But rest assured, when that happens, it's a normal reaction by a healthy body that's trying to keep you safe. That's really what's happening, okay? Any questions about that before I move on? Okay, great. So some of the things that people don't think about as much, or it's really actually different when you start losing weight, are things like what counts as activity, what's your sleep doing? You may have talked about some of these during your sessions here, and what your mood might be doing.
What's the first one?
Activity. So activity is one that tricks a lot of people. I always ask people, well, how active are you? When my patients say, I'm trying to lose weight and I'm doing everything I can, and one of the first things I ask is, how active are you? And then I have them tell me what they do during the day and what they're doing for exercise. And oftentimes, there are a couple of things that as soon as they say it, then I realize, okay, this might be part of what needs to change. You can be an active person, and that means different things to different people. There's certain jobs that I think of that I would say, those are active jobs, and there's some jobs that I would think of that are not necessarily very active jobs. Most of us would agree that the people who work on the roads, the people who are working in the parks clearing things, people who work as athletes, those are active jobs. They're up and down all the time doing something. They're lifting something. They're actually exerting themselves. Most of us would agree that if you work in an office setting where you sit most of the time, that would not count as an active job. There's a lot of stuff in between there where you could think it's an active job, but it's not really burning a lot of calories. People who work in retail, some people are walking a lot, some people are not walking a lot. So if you tell me I work in the grocery store and I think it's an active job, I need to know what you're doing to really tell you if it's an active job or not. The reason that matters is that the more active you are, the more calories you burn. And that's how you start to lose weight. It really is, if you think about what your body needs with its calories from what you eat and what happens. If you think about a sink filling up with water, every time you eat something, that's kind of like the sink starting to fill up with water. As the sink drains out, that's you burning it off. And what you're trying to do is not accumulate water in this sink. That's what you're trying to do when you're trying to either keep your weight the same or lose some weight. And so if you're eating more than you're burning off, you're going to gain weight. If you want to stay the same weight, it needs to be about the same. If you're trying to lose weight, you've got to burn off more than that. And so a lot of times I'll get told things like, well, I play football with my grandkids. Who thinks that counts as active? Who wants more information? That's the trick. So when I hear I play football with my grandkids, my next question is, so what are you exactly doing? And sometimes I get, I'm running around the field with my grandkids, I'm throwing it, I'm catching it, I'm running up and down this whole field. Sometimes I get, I take my grandkids to the field and I watch them play. And that counts as playing football with my grandkids. Can you see how those are different? So that information is really important. All of you have a regular amount of calories that you burn by breathing, by having your heart beat, by getting up and doing your regular stuff. Putting your clothes on, getting your food, talking to people, that burns calories for you. It takes energy. That's your normal. Anything you do above that is what then starts to burn things for you. Your regular daily activity is not going to count because that's what your body is used to. And so you'll find that if, say, an athlete starts trying to lose weight, they need to do a whole lot more than you would expect because on a normal daily basis, they're doing a lot of stuff, more than what most of us are doing. So the trick with that is that what you burn off is not always what you assume is coming from your food. I like to pick on Oreo cookies because people like Oreo cookies. Who in here eats Oreo cookies? I'm sorry, I'm about to ruin it for you. Okay, sorry about this. So most Oreo cookies, not the double stuffed ones, I think the double stuffed ones have more calories to them. Most Oreo cookies per cookie are about 60 calories to 80 calories per cookie. One of those calories is about that. Can you guess how many minutes you have to walk to burn off the one cookie? Close, yep. It's pretty close. So for burning off one of those cookies, you need to be walking pretty briskly, not like a stroll, pretty briskly for about 28 minutes to burn off the one cookie. And a lot of people don't see the difference there. So then they're like, okay, so do I have the cookie and go for the walk? Or do I just not have the cookie and maybe go for the walk? And so with activity, unless you are really dedicated to increasing your activity, the food almost always wins in terms of just don't have the extra food. It's easier if you're trying to lose weight to not have the Oreo cookie than to have the Oreo cookie and go find the time to do the 28 minutes of moderate exercise. If you can, great. I would love you guys out there walking. That's awesome. And if you just happen to have this cookie one day and you want to make sure that you don't add the calories, go take the walk. But it's a lot more than most people think. If you have 2 Oreo cookies, you're going to be out walking almost an hour just to burn off the 2 cookies. So food is not always as easy as you expect. And if you've seen these cookies, they're about, I don't know, about that big. They're not very big, but they pack a lot of calories and energy onto you. Anybody in here like to eat nuts? Peanuts, cashews? So nuts in general are great for you. They have lots of minerals, they have healthy fats, they have fiber. They're generally really good for you. They're also very high in calories. And so you have to be careful when you sit down to eat a bunch of nuts that you're not just picking up handfuls of nuts all the time, because the next thing you know, you've eaten a meal worth of nuts. They're generally good for you, but you have to keep an eye on them. Anybody in here like avocados? I love avocados. Same deal. Very, very calorie dense, but they're great for you. So I often tell people, have your avocado. Please don't eat 2 of them because you've pretty much eaten a meal. worth of calories if you eat 2 avocados. It's a lot of calories. Questions about that before I go on? I was going to talk about sleep. Yes?
Like fruit.
Mm-hmm.
Like a watermelon.
Mm-hmm.
You know, I like watermelon, and it kind of makes me gain weight because of water.
Typically, no, but that's a good question. Typically, you should pee that water off. You should urinate the water off. And that goes with most fruit that have a very high water content. Typically, you hold on to water if there's also salt attached to it. That's when you tend to hold on to the water. But if it's water that's within fruit, so melons and things like that, you wouldn't be expected to hold on to that water and gain water weight. You would most likely urinate that out later on. Those types of fruits are great for you because they tend to fill you up, and then you don't go and eat a whole bunch of other stuff. But they don't have a lot of calories because they're mostly water. And so watermelon is a great thing for people to snack on because it really doesn't give you a lot of calories.
Yeah, I was going to ask you, I was hearing like certain fruits are not exactly best to eat, especially the weight loss. Like for me, like I love grapes.
Mm-hmm. That's one.
Specifically green grapes.
Mm-hmm.
Now, I have been told a problem with grapes though is that if they're small, it's like nuts.
Yeah.
Keep going. Compared to, like you said, watermelon per se.
Mm-hmm.
I guess I'm not even eating like a big, huge
You could.
piece of watermelon, something like that. That's my thing. Like watermelon, not grapes.
Yeah.
Good, but again, because they, you know, there's a bunch of them.
Yes.
Full, but again, are those, you know, are those good? I guess good
Mm-hmm.
fruit, especially the weight loss.
So I never call any fruit not good to eat. I think largely fruits and vegetables will always get a yes. For different people in terms of, and this is not with weight specifically, for blood sugar, some fruits will increase people's blood sugars more than others. And it's not always the same. Grapes are one in that group. Mangoes are another one in that group, where for some people, they'll see a blood sugar bump, and for some people, they just won't. Grapes are an interesting group because they have tons of fiber in them, which is great. The fiber of the grapes is great. The trick with them is you're right. A handful of grapes happens, and then there's like a bunch of grapes that happens, and then there's a bowl of grapes that happens because they're all small. And almost no one in this room is going to sit there and count out 20 grapes that, that they're going to have that night. That's just not a thing. So I wouldn't say not to have them. I think what my suggestion with things like grapes are for most people is as soon as you get them home, and we'll talk about this a little bit more, I tell them to portion it off so that you don't pull out the bag of grapes when you're like, I want some grapes now. And then you pull this bag out, and the next thing you know, you've left 2 grapes in the bag. So as soon as you get it home, break the pieces off and portion it into different sections so that when you put your hand in the fridge, you pull out one section and you leave the rest in the fridge. And then you just walk away and you're done. That's probably the way to trick yourself into doing it.
Before you got onto the fruits, I wanted to know, so what was your recommendation on how much avocado you should eat? It was like, don't eat 2, so I was like, all right,
It depends in part on what else you're eating. Because I look at everything that you're eating as one. So if you're having avocado toast, and you tell me, I plan to have 1 piece of toast, which is usually, I don't know, about 60 calories or so, somewhere around there, 60 to maybe 100 calories. And I'm going to cut up some avocado and put this on that. I would say you're probably good to have half to almost to the whole avocado if that's your meal. If you plan on having chicken, rice, something else, and dessert, and the drink, and the avocado, then I would say have a couple slices and put the rest away. It really depends on everything that you're eating at the same time.
what about when you cut it up and put it in a salad?
Also depends on how much you use as well. And if you're having the salad with something else. If the salad is your meal, the avocado ends up giving you a bunch of fiber as well as the fat for that. And it fills you up, which is a good thing. For those things, I think half to a whole avocado, that's like one of the smaller ones, I think is fine. It's interesting. The larger ones, they're very watery, so I think they actually have fewer calories even though they're bigger. The really dense ones, the Hass avocados, I think have more calories to them. But you're welcome. If it's a meal, make it your meal, make it a good meal. But if it's avocado and a salad plus the whole other meal, then you got to think about what you're doing. That's how salads often trick people, because once you throw the nuts in, the salad dressing, the avocado, the bacon bits, and all this other stuff, you essentially have made yourself 2 meals. You haven't given yourself a salad and a meal. You've made yourself 2 meals. It happens very quickly. Looks good, but it happens very quickly. Sleep. Anyone in this room have trouble sleeping? You are one of 60-something% of people in this country who have trouble sleeping. It's very, very common. Sometimes it's trouble falling asleep. Sometimes it's trouble staying asleep. Sometimes you've fallen asleep totally fine and you wake up at 3 and you can't get back to sleep. Any of those combinations are pretty common. And none of them are great. So hopefully, all of you with sleep difficulties are working on ways to help that get better. There are lots of non-medication related ways to help your sleep get better. Mm-hmm. Perfect. So you're one of those people that gets wound down by a workout, which is great. Some of us, like me, I wake up if I have a workout. It wakes me up. And so it's better for me to do my workouts in the morning so I'm ready for the day. But a lot of people, working out kind of is a good stress relief, and it helps them sleep a lot better. So you sort of have to figure out which person you are. But that's a great one to actually work for your sleep. For some people, it's making sure they're off their screens. Some people will need to avoid alcohol because that will mess with their sleep. Meditation will sometimes work. Generally, activity is thought to be a good thing. And then outside of that, you start looking for supplemental ways or medication ways to help with your sleep. I bring this up because I feel as though in this country, we're used to working so hard that we overlook sleep as a good thing. Sleep is really necessary. We're supposed to be spending about 1/3 of our lives sleeping. You know, about 8 hours a day-ish. You should be asleep for about 1/3 of your life. And for those of us who are not getting that, it starts to impact things like weight. Sleep is supposed to help regulate lots and lots of hormones for you. And when you don't get enough sleep, those hormonal cycles go completely off kilter. So that includes the sleep, welcome. That includes the sleep patterns I described, as well as if you have something called sleep apnea. I don't know if any of you have that or know of someone who has that. That's where you sort of wake up in the middle of the night gasping because you're not breathing well enough. All of those disrupt your hormonal cycles, and hormones control your weight. So if you do have sleep-related issues that are not addressed, I encourage you to talk with your providers about that as well, because on weight loss, I mean, it's good for everything, but if you're on a weight loss journey or a weight maintenance journey, the sleep issue itself is probably messing with your ability to get to where you need to get to. Yes? Hmm? Yes.
The less I'm waking up.
Excellent.
I think more in the winter months.
Mm-hmm.
For some strange reason, I struggle more with it, but most of the time, I can sleep through the night if I'm not going to bed.
That's excellent. And that does happen. For most people, when they start losing weight, their sleep apnea gets better, which is helpful. Yes?
What's sleep apnea?
So it's a condition where when you're asleep, your body wakes itself up because you're not getting enough air in. And it's usually because this area of your neck or on the inside, it sort of closes down when you go to sleep. And so it wakes you up because you're gasping for air. A lot of people will either jump up out of bed or they'll just kind of, but it's now disrupted your sleep. And sometimes it's enough to really wake you up where you're like, oh, I'm awake. Sometimes it happens 20-something times per night, but you're not awake enough to realize what happened until you actually have a sleep test. And they say, oh, you wake up 35 times a night gasping and you just don't realize what's happening. And so that's not good for your body in any way. And it can be really a problem if it's not treated. Other questions? It's one of the things I often advise men who have testosterone-related issues to get tested for, because it disrupts all of your hormonal cycles. And so men who have sleep apnea have lower testosterone. They just don't make it as much. Once you fix the sleep apnea, their testosterone comes back up, which is a nice way of getting them to actually go treat the sleep apnea. But yeah, so it's one of those things to think about. Medications. This is a nice punching bag that everybody usually uses, and it's not always wrong. Some medications make it harder for you to lose weight or will make you gain weight. That is all true. Steroids are a common one. Things like prednisone will typically make people gain weight. There's some antidepressants, some mood medications that will make it more likely for you to gain weight. And there are other different types that some of the medications they use for types of cancer will make you gain weight. What should happen is that if you're about to be treated with a medication that will affect your weight, your provider should tell you. And most providers I know will warn you about it. I'm going to put you on this medication. It will probably make you gain weight. So you need to cut back on your eating. You need to anticipate the weight gain. You need to increase your exercise, whatever it is. They should warn you about it so that you don't get 10 pounds in and then realize, oh, I've gained 10 pounds and I didn't know it was coming. Anytime you have a new medication added, please ask your providers if it will affect your weight. Because then you can anticipate it and then potentially do things to maybe offset that. If you don't know it was coming, you'll gain the weight before you ever find out it was coming in the first place. And it's harder to lose it once you've gotten it. So one thing I always recommend to patients, anytime a provider plans on adding a medication, ask them, one of the side effects, is this going to affect my weight? If this is of concern to you. If it's not a concern to you, you don't have to worry about it. But I think it's something to always ask. Questions about that first? Okay, that's one of the things that I find that people just don't actually talk about very much, and it's really, really important. So a couple of things to show you. Where did Angela go? Because I'm just about to stand up to show you guys the bowls back here. Thyroid issues are a common question that I get as well. For those of you who don't know, your thyroid is a gland that sits in the front of your neck. It looks like a little butterfly. If you put your hand right here and you swallow, you should feel a little thing that feels kind of like a piece of fish. If you swallow, it should slip up under so right above your collarbone. You take a minute and you swallow, and you should feel it slip up under your finger. That's your thyroid gland. For most people, it's not very big. So if you don't feel it, that doesn't mean you don't have one. It's in there somewhere. It's in there somewhere. And so that makes thyroid hormone for you. That regulates a lot of your metabolism, your energy, and a lot of things that are directly related to weight. So if the gland is making too much, people often will lose weight without trying. If it's not making enough, you can gain weight without having changed anything. And both of those are conditions that have to be treated. A question I often get asked is, does thyroid medication make me gain weight? If you're taking a medication that is supposed to be a thyroid hormone, it should not make you gain weight unless the dose is wrong. And so if you're on a thyroid medication and you are gaining weight, then you should ask your provider to make sure the dose is right. The medication alone does not make you gain weight. But if the dose is wrong, yes, you can actually gain weight without planning to do that. But the medication alone does not make you gain weight. It's not like prednisone where everybody tends to gain weight. Thyroid medication is different. It really depends on the dose. Any questions on the thyroid one? I get that question a lot because thyroid is another happy punching bag for weight-related issues. Okay, now I'm going to get up and they're going to yell at me because they're supposed to stop this camera, but I'm going to do it because I have to show you guys this. First, does any of you have a pedometer or a watch that tracks your activity? Your phones? Perfect. These are really helpful because remember we talked about activity? These are the truth tellers. This will hopefully also tell you how active you really are being. We're not very good judges of what we eat or how active we are unless we're actually tracking it. The times you know what you've actually eaten are when you write it down. If I just ask, what did you eat yesterday and the day before and the day before? No one in this room is going to be able to remember it accurately. We just don't. You just don't remember it. You will know it if you've written it down. This is kind of like one of those. Most of us don't remember how active we've been or not as active we've been unless you're actually measuring it. And so if activity is something that you're really looking at for yourself, either for weight maintenance or losing weight, I would encourage you to get something that tracks it. Otherwise, you will not remember accurately what you have done. And there's a big difference between 15 minutes of walking and 20 minutes of walking and 25 minutes of walking when it comes to weight loss. It really does. And so knowing what you're actually doing is important. That's why you weigh yourself. You can't feel 5 pounds smaller. You have to either be 5 pounds less or not be 5 pounds less. That's like people telling me, I feel like my blood sugar is 212. Well, you can't feel that. You either have a blood sugar of 212 or you don't. So there's some things that you have to measure to know what you're doing. Otherwise, you'll never be truthful with yourself enough to know what you're actually getting out of it and what you need to change. Now I'm going to show you the bowls before the yoga people start going. Okay, so one of my favorite things that people don't talk a lot about is what portion sizes look like. Anyone in here like chips? Okay, so don't get tempted by what I'm about to put out here, but this is this is important for you to see. I know I am going to tempt you guys with these. Okay. So these are portions of chips. I want you to look at them. This is not a test. It's just, if you fail, you can't leave here until, no, I'm just kidding. And of course, these are just demos of chips that we're going to talk about. So for all the chip eaters, if you had to, and be truthful, if you were going to sit down tonight to have a bowl of chips, which would you pick? You pick the bag. Thanks for the truth. Okay. You'd pick the bag. This one? Okay, so people like this one. What's wrong with this one? Looks too small. Okay. What's wrong with this one? Not enough in the bowl. And this one?
And they're probably all the same equal.
Would I pull a trick like that? So there's a couple points to this. This bowl is the smallest bowl, and it's the fewest calories. Now, if you are trying to not eat as many calories, it's not a bad bowl to pick. This is half a serving, so you always look on the back. All of you guys know this now. You look on the back to see what the serving is that's recommended and how many calories. That you got to do. This is half a serving of the chips that I pulled out, okay? This is 70 calories, which is not bad for a snack, actually. But for some of you, you're going to be like, that's too little. This is what I'd give like my 8-year-old. So part of that is important because you do have to be honest with yourself. If you know, if I sit down and eat this, I'm still going to be hungry and go look for something else. You do have to recognize that truth about yourself and don't set yourself up to where you're going to fail. If you know you're going to eat this and go find a Kit Kat, don't pick it. That's kind of the truth of it. So, okay, this won't do for you. Not a bad thing. I stand guilty with these. These are exactly the same. These are all one serving of the chips. They're all 140 calories, but they look obviously different based on what you put them in. And so one of the other tricks about figuring out what to eat is to trick yourself into what this looks like. So I will often tell people, pick a smaller plate because the food will look like it's so much more on the smaller plate than if you put it on the largest plate you have in your kitchen. Then it just looks like you don't have enough food and you go back and put more on the plate. These are all reasonably sized bowls. I would agree. If you put it in this, you're going to look at this and be like, what did I put in this bowl? So you likely wouldn't pick this. But either of these two are reasonable, but they're exactly the same amount of chips, exactly the same amount of calories, but they look different. And our brain will work to tell you, if you pick this one up, it looks like you haven't eaten enough. If you pick this one up, your brain will likely tell you you have a full bowl of chips. And it's exactly the same. So you would be likely to go back and try to refill this one, but you would not do that with this. So one of the things that often helps if you're working on your portions and you're trying to really watch what you do with that is to try to pick a bowl or a plate that will make it look like you're eating more than you think you are. It's a visual trick to tell your brain you've had enough. And that's what you do with these. But don't make it so that it's obvious that you haven't had enough. And don't make it so that you already know that you're going to be hungry after eating this. So we leave these off, but either of these would probably be acceptable. I would recommend you pick something like this. This is kind of what you could do with the grapes. Don't put your grapes in this, because then you know you're not getting that many grapes. If they're falling out of this, that won't necessarily work. But if you put your grapes in things like these, I think it helps you just visually thinking about what you're actually eating. A lot of what we do with eating habits are not your stomach, it's your brain. And you have to trick your brain into thinking about your food in a different way. And things like this and the plate size, they really do help. So utilize things like that to make it easy on yourself. That way you're not struggling trying to figure out what to do. Pre-portioning is a huge one. Yes, it's an extra step, but I think it's worth it. The grocery stores have capitalized on this. You can see all of the pre-packed 100-calorie bags, and they always cost $2 more than the exact same amount in the whole bag. But if you can afford it, I think it's worth it because it stops you from overeating. you will reach in and grab 1 calorie pack and walk away, most likely, instead of grabbing this and sitting down and eating half the bag, which will be 3 times as many calories by the time you realize I've eaten half this bag of chips. So if you see those, it's helpful. Otherwise, I recommend when people get these bags at home, portion it immediately if you're really working on watching your calories. Throw out a small amount into Ziploc bags, into smaller containers, into bowls, into Tupperware, and when you put your hand in your closet, you pull out one of those, close the door, and walk away, and you're done. Most people will not go back in there and go find another piece of Tupperware to open that up. Most will not. It takes effort to do that. There are a lot of tricks that people do to stop themselves from going for seconds. They'll put it further away. I've seen in offices that they'll put the water closest to where everyone's working and they put the soda at the far end of the hall. Those are ways to trick people into making decisions that are more helpful and make it harder for them to make decisions that won't be as good. So people will go for the water. If they really want the soda, they'll make the trek. But most of the time, you'll just stop and get the water and go back to work. You're not going to go all the way down the hall and down the stairway to go get the soda. Those are the ways you kind of trick yourself into making better decisions for yourself. With food choices, I often, to your point about the watermelon, I often encourage people to eat food that, years ago there was a diet called the volumetrics diet, which is based on this idea of eating water-heavy type food and fiber-heavy food. So it's usually salad, a lot of fruit, things like that, because it fills you up. Soup is another one of those things. Most people get pretty filled up if you eat a lot of soup, like this much soup, and you don't go back and then eat half a pizza because you're filled up with all of this soup. Soup in general has a lot fewer calories, most soup, not all soup, because it's mostly liquid and it fills you up. So choosing correctly will fill you up so that you don't go back and you eat a lot of things that are more calorie dense for you. That's sort of tricking your stomach by making it expand. And so it feels like, oh yeah, it's full, even though it's mostly filled with broth, but it feels full, and so you don't go back and you eat a bunch of bread with the soup. So those are some of the tricks that I often will tell people to use. Questions about this? Okay. And just another plug to read your labels very carefully. 2 green bags of chips. Yeah, I know. I asked them out there about this. 2 green bags of chips, similar flavors. They look like they're decent multi-grain-ish looking chips, right? But they're not the same. These are both 130 calories per serving. However, 9 chips, 12 chips. That actually does make a difference when you start looking at servings. So check your servings on the back, even though the bags look about the same. These are important things, again, when you're watching your weight. All of those little calories, just like the Oreo cookie, they start adding up. If you have this snack and then you have the Oreo and you have something else, the next thing you know, you're 300 calories ahead of your target without even really thinking about it. The portion sizes matter quite a bit. If you decided I was going to have 2 sets of portion sizes, that would be 18 versus 24. And that does start to make a difference when you put it in your bowl. So check the back always. Questions?
Not a question.
Yeah.
In order to eat less ice cream,
Mm-hmm.
I'm doing like, I started to get this real plain yogurt now
Uh-huh.
with blueberries. But I'm finding that I'm doing it a lot.
Okay.
You know, and
You're doing the yogurt and blueberries a lot?
yeah,
Okay.
maybe twice a day.
Okay.
To, you know, to increase the protein and to get a handful of blueberries.
Mm-hmm.
But to avoid
The ice cream.
or to avoid, like before I came here, I had a cup of plain yogurt,
Mm-hmm.
handful of blueberries with a sprinkle of cinnamon.
So we're sisters, because I had the same thing, except I had agave syrup with my blueberries and yogurt. That's pretty funny.
A pinch of agave.
Isn't that good?
Like,
So yeah, that combo is really good. I see why you're eating it all the time. So a couple questions about that. Are you avoiding the ice cream because of the fat, the sugar, or the calories?
all of the above.
All of the above. Okay. Do you know how many calories you're taking in with the yogurt or the blueberries?
I'm just in my brain.
You think it's
I
better?
told myself that the yogurt is better. There's no sugar in
Mhm.
the plain yogurt. I can control the. Sometimes I don't even have the agave. Sometimes the cinnamon and the taste of the
Mhm.
blueberries is really enough.
Is enough. Okay.
Yeah.
So in terms of nutrition, you're winning.
Okay.
Totally winning. A protein-heavy yogurt and the blueberries, I mean, that's total winner there compared to the ice cream. You're making a good choice there in terms of the nutrition content. In terms of weight, I can't tell you unless I know how many calories you're taking in. So and this is a question I often get too. I'm eating a healthy diet. Why am I not losing weight? And I always say the same thing. Congrats on choosing healthy things. That's great. But if you're trying to lose weight, it still comes down to calories. So that's like having the avocado versus a piece of fried chicken. The avocado wins in terms of being healthier for you. But if you're trying to lose weight, it needs to be fewer calories than the fried chicken. Otherwise, your weight's not going to go down. It's always going to be calories if you're trying to lose weight. You can gain weight on a healthy diet very easily. Very easily.
How many calories should we be taking in a day?
Depends on what you are now, what you do normally for your activity, and what you're trying to lose. Most people of regular adult size, now that's a huge range of what we think of as regular adult size. For most people, they need to cut their food back by about 300 to 500 calories per day to lose 1 pound a week. And that's from whatever you eat. So if most adults take in between 2,000 to about 2,400 calories a day. That's about average. Some people take in way more than that. Some people take in less than that. Michael Phelps, our illustrious Olympic swimmer, I think he was taking in like 9,000 calories a day or something like that. But I mean, the guy was swimming like and burning it all off. So if you're doing that level of activity, you're of course burning off more. But most adults are somewhere between 2,000 and about 2,400 calories a day. So that means you should cut it back to at least 2,100 calories if you're up at 2,400, or 1,900 calories to lose 1 pound a week. Now, I typically tell people to aim for losing 0.5 to 1 pound a week as slow, responsible weight loss. Because, going back to point number 1, you don't want your body worried that you're losing weight. So the slower you lose it, it's better for you. Then your body's not getting worried about you losing weight. It's just kind of slowly drifting off. And you are less likely to regain the weight if you lose it slowly. If you drop 10 pounds in a month, congrats that you can now fit in these new pants that you want. That's nice. But your body has now been told something is wrong, and you are more likely to regain that next month. Because 10 pounds weight loss in a month is a lot. Your body would think something's off. You shouldn't be losing that much weight. You want to lose maybe 2 to 4 pounds a month. That actually is what we consider medically safe weight loss, where you are not likely to trigger those hormones to try to gain it back. Slow and steady does win the race.
If slow and steady wins the race, I'm trying to understand doctors giving so much weight loss drugs.
So that's a separate conversation
Okay,
for.
they tried it with me, and I said, no, I don't want it. Because I lost 10 pounds last year.
Great.
And I lost some, since we started this program, I
Mhm.
lost some pounds. But my doctor was trying to push,
Mhm.
and I said, no, I'm losing weight. I'm losing it slowly.
Mhm.
And that's the way I want to do it. Plus, the whole reason why I'm in this program is because I don't want to take any more drugs.
Okay. And those are all good points. So some of the weight loss medicines that have been recommended recently is also because they have other benefits. It's not just because of the weight. So I don't know why your doctor wants you to be on a particular medication, but in some cases, some of them have heart-related benefits or blood sugar-related things, and that might be why they're trying to get you on that. The other reason is because most people do regain the weight. And so the concern is, that's great for you that you've lost this amount of weight, and your provider might be thinking, she's going to be at risk for regaining it. Maybe giving this extra thing will help her not regain it. But to your point, I mean, most doctors are thrilled if people can lose weight without having to need a medication. I don't like adding more medication. It's more side effects, more cost, more everything else for people. So if you can do it without taking more medication, the better for you. I think they may be concerned about you regaining it, but you'd have to ask. And a lot of them do make people lose weight really fast. They do. But if you stay on the medication, you're likely to keep it off so they don't worry about you regaining it, because those medications work on those hormones I was talking about so that they don't kick back up. Yeah.
Going back to
Mm-hmm.
measure your activity. So let's say I'm very sedentary and I'm kind of starting to exercise and stuff. So the easiest thing for me to do is start walking.
Mm-hmm.
So does it matter? My question is, does it matter the amount of time, the distance, or like some people are like the heart rate and the
Mm-hmm.
speed, and like what's more important to how do I like work on?
To getting there. So all three. Level of exertion is what we talk about with your activity. And so I had a lady once who told me that she went on walks every evening with her fiance, which sounds nice. And then I said, so tell me how you guys are walking. And she's like, well, we hold hands and we walk around the lake. And I said, that's really sweet, but it's not helping you. So give him a kiss and you take off. And you need to walk. You need to be really working on this. Otherwise, that's nice time together. I'm thrilled that you're outside getting some fresh air and you're bonding with your fiance. But for weight loss, it's doing you no good. So you do have to start somewhere. And so we know that if you normally don't have a lot of activity, doing anything is going to help you live longer and have less heart disease. So you've already won by even starting. That alone is going to help you. If you sit less, you will live longer. We already know that. So you've already made one huge step in just starting it. Now, in terms of weight loss goals, we always tell people again, start slow, because you don't want to hurt yourself. You don't want to get discouraged because you started off and then you pulled a muscle and now you can't walk for 2 months, or you strained something. So you start slow, and oftentimes I would recommend time goals. A time goal. If you're doing nothing, and that's where you're starting, you aim for 10, 15 minutes a day of what you can tolerate. You just want to start and develop a habit. The habit is what will keep you going, so that when you kick up your intensity, you'll keep doing it, even though it's harder. If you jump into it and it was never a habit in the first place, as soon as you start to hit 20 minutes, 25 minutes, and it's hard, you won't keep doing it. So it's better to have a couple weeks where you're doing 15 minutes, even if it doesn't feel like a lot, but you start to feel like, oh, it's 5 o'clock, it's time for me to go. That's a habit. So that when you then change that to 25 minutes, 30 minutes, and you're sweating, you still stick it out, because this is a habit that you have. Most people need to get to about 30 minutes, 5 days a week. That's the recommendation, just to keep your heart healthy, to start trying to trigger anything. That's 150 minutes of exercise per week over the course of the week. Some people need to break it up differently. If you've got 5 days where you can do half an hour, that's awesome. If it's Saturday where you do 45 minutes and another day where you do 15 minutes, as long as you're getting 150 minutes in that week, that's what we recommend for you to be heart healthy. If you're trying to lose weight, I tell people to aim for 300. And so that obviously takes time. Not everybody is able to get to 300 minutes of exercise in a week, but that's kind of the golden trigger for a lot of people, is that will then trigger a lot of energy balance in your system, where you will start to lose weight if you're at 300 minutes a week, spread out over the course of the week. That could be 3 one-hour sessions at the gym, and then you add in some extra time in there, but it's 300 minutes seems to be kind of a magic number that helps a lot of people actually get to their weight loss. Under that is great for you regardless. It's good for your sleep, it's good for your bones, it's good for your heart, it's good for your brain. It always counts. But if you're looking to lose weight, you're aiming for around 300 minutes over the course of a week.
What's the 10,000 steps? I always hear this, 10,000 steps.
That's mostly for heart healthy reasons. It's they had done a study at some point where this seems to be like a good number for people to have less heart disease and keep your brain healthy. And I think it also is related to risks of dementia. So it's a nice number to think of. It's a nice number to like write down somewhere. But again, more of the recent research that we have also tells us anything you do is going to be helpful. As a country, we tend to sit a lot. We go everywhere in cars or buses or something else. We don't walk as much as many other countries do. Some people do, but as a country, we don't. And so we spend a lot of time sitting. And the less time you spend sitting, your life is going to be better, and you tend to have less of a risk of heart disease. So no matter where you start off, if you do anything above that, it's going to help you. Other questions? Yes? Strength training?
You know, nothing extraordinary, just some like pills and little muscle.
Mm-hmm.
So I read that once you're doing like strength training or strength resistance training, I don't quite understand the difference, but like I'm learning, it burns calories even after you stop exercise.
Yes.
So my question is, for such things, is it better to do it before you eat a meal or after you eat a meal?
There's still arguments about that, and I can't give you a straight answer. It used to be said that you should do it before, and then they had other studies in sports medicine that said that you should do it after. I don't know if there actually is a straight answer anymore, and I don't know if it affects regular people like us who are non-big athletes. Maybe it's the people doing a ton of exercise who get that much benefit, but right now I don't have a straight answer as if you do it before or after. I think the most important thing is that you just do it. The other thing to keep in mind, for those of you who do weight training, I always warn patients as well, if you really start getting into weight training, don't be upset if the scale doesn't change, because muscle weighs more than fat. And so as you start to gain muscle weight, your weight may not go down anymore. But it's great that you're gaining muscle weight. So don't be distressed that, well, I weighed this before and I started going to the gym and lifting weights and now I weigh the same thing. Well, it may be because you actually have gained muscle weight, which is great. So keep that in mind depending on how much you're working out. Muscle does weigh more than fat. And so if you're adding a bunch of muscle, your weight may not change. But your metabolism will, and it's all beneficial for you. We'll see you when you're bench pressing the 300 pounds next time. We're cheering you on for that.
Like I said, wait.
Weight training is also great for your bone strength. So I always recommend that everybody do some degree of resistance training.
Talk about walking.
Mm-hmm.
Great. I walk a lot.
Mm-hmm.
But some people have bad knees.
Yes.
Can't really do it. Guess stationary.
Stationary bike.
Bikes would
They're great. If you can get on one of those, they're fantastic. You just have to have access to it. Either you get one for yourself or you have to be in a facility. Yes, exactly. Have space in the house for it, or you get to a facility where they have one. They're wonderful, and it is better on your knees. The other thing is if you have access to a pool, then that takes the pressure off your knees when you're actually walking in the water. A lot of people do water aerobics and get their walking in there. It takes a lot of pressure off your knees and your back if you have back issues. Mm-hmm.
That's how I lost my water.
Water aerobics, yeah. It's great when you have access to a pool. It takes a ton of pressure off, and you can exercise often for a longer time in the pool. And it gives you some of the resistance training. So it's a win-win if you have access to it. Yeah. Other questions, thoughts?
So I'm sorry, I
Yeah.
missed the beginning.
You're okay.
Sorry. But, so you're suggesting that we count calories? Is that how it's
Always. Always. It's one of those things where you can feel some things, but you really don't know what you're doing with weight loss unless you know that balance is negative, that you're burning off more than you're taking in. You have to know what you're eating.
And how do you feel about it? About it, the Weight Watchers way of counting?
I think
They
it's
don't
great.
count calories, they count points.
Yes, they count points. So Weight Watchers is one of the diet plans that actually has great research data on it. People do lose weight and they maintain their weight loss. So even though they don't count it as calories and they do it as points, it's related to calories in kind of a behind the door way. And it works great. Because in part it works great because people pick the points that matter to them.
Right.
Somebody doesn't come in and tell you this is what you have to eat. You come up with it on your own based on your cultural preferences, what you have in your house, what you can afford. And so you're able to stick with it better. And you count the points that actually matter to you. It's a great diet to follow. I think it's one of the commercial diets that has the best evidence for people losing weight and keeping it off in a healthy way. And I think they now have a diabetes arm that's very specific. It's one of the ones that I think is pretty good if you can stick with it.
I've been on it over the years many times, and I always gain weight back, but I guess I'm not going to put it on that.
No, you can't. And that was the part of the talk that you missed. So now I get to tell you. It's good and bad news. Your body did what it was supposed to. Bodies are supposed to gain the weight back. We just weren't designed to lose weight. If you think about what we were when we were hunter-gatherers, you're supposed to be holding on to this energy for when you don't have food and you otherwise would be starving. Your body is meant to hold on to energy just by the way it's built. And so losing weight is not what it's supposed to be doing. trying to regain it is your poor healthy body saying, you shouldn't have lost this weight in the first place, and I'm going to help you and gain it back for you. And so it's trying to do the right thing. It's just that you don't want it. And so you're trying to tell it, no, I actually didn't want that weight in the first place, but your body thinks it has done you a favor. And so we try to find ways around it by getting past those hormonal signals that are trying to get your weight back. But it did what it was supposed to. It just wasn't your goal. Yep. It's on hands. So it depends on you. The problem with counting calories for most people is that if you don't do it right away, you forget. And so you kind of have to find a method that works for you. With my first pregnancy, I had twins, and I was much larger than I am right now, and I also had gestational diabetes, so I had to work hard to lose my weight after my pregnancy. Otherwise, I would have had a very high chance of having diabetes after my children were born. So I had a weight loss, I had a calorie tracker on my phone. Every single thing I put into my mouth went into that tracker. Otherwise, I'd forget. I had 2 babies to attend to. I wasn't writing stuff down later. I would never remember. So as soon as I ate something, it went right into the phone. And then later that night, I would look back and see if I was calorie negative. So that worked for me. There are lots and lots of calorie apps on different types of smartphones.
Yeah, I was going to ask you, any apps or anything you might recommend?
Tons of them. So I'm trying to think of the one that I had used. I think, was MyFitnessPal is the one that I used. It's been around for a bit, and they update it with all the new foods, all of the, they typically, yeah, and exactly. I mean, they've updated it really well. It's great. That's the one that I used for both my pregnancies, and that's the one I often recommend that people use. So if you have a smartphone, it's easy to do that, and you won't then have to go back later and try to remember, how many of those chips did I eat? You just put it in right then. Some people will write it down, and then some people have a book. I have patients who will pull it out of a book and look it up. Yep.
How many calories do you need each day?
That also depends on what you're doing. So most adults need anywhere between about 1,800 to 2,400 calories a day just to keep their weight the same and do everything you need to do. To breathe, to think, to keep your heart beating, to get up and walk around, to change your clothes. That's kind of what you need to just be you. But it depends on who you are and what your weight is and what you do every day. For the people who are more active, they probably need higher, closer to the 2,400. And for the people who don't do a lot of activity, they probably don't need as much. Questions? Others? So my last words, if you are on a weight loss journey, try not to be too hard on yourself. Again, your body was not meant to lose weight. And it's often frustrating when people are like, this is great, and then all of a sudden I've regained this weight back. It's doing what a healthy body is supposed to do. We're just trying to get around it. And so the tricks like, figuring out how you can trick yourself into the right portions and asking about weight loss medicines if it's right for you and you're interested in it. Those are all ways that you get yourself to that point. But a lot of it is sort of a mental trick that you have to do and keeping it easy for yourself. And realizing that you really do have to count the calories. I hate telling people that you have to do this more work, but you have no idea what you're eating unless you actually count them. You just don't know. You can't guess.
I know what I'm eating, that's why I want to count.
So check the calorie counts. They're always important. Yes? I'm sorry? How much weight did I gain? During my pregnancy? 80 pounds. 80 pounds to birth those 2 healthy babies. Thank God I had 2 healthy babies. They weighed perfectly, and they were healthy babies, and then I had to go lose all that weight back. So, but yeah, I was like, I'm immensely grateful that I had healthy babies, and I'm thrilled with that, but now I got to work on my own health. And so that was why I got the calorie tracker, to make sure I got my weight back. And my diabetes went away and did not come back after that. But it took a lot of work. So when people tell me, I hate checking my finger sticks for diabetes, I'm like, yep, I know. I've done it. I did it for 8 months, and it was hard. So I know exactly what it's like. I was checking my fingers 8 times a day. I know exactly what it felt like. And when they say it's really hard to lose, I go like, yep, I know that. I know that. My spouse would have told you that was the grouchiest I was in my entire life. It's not fun to do. But it was important. It was important for me to do because I wanted my health back.
I have a question. You talked about the biggest thing.
Mm-hmm.
Now, after you eat something and you check your sugar and you notice that your sugar goes
Uh-huh.
Now, is that an indication that you should be eating that particular food with something else, or not eating it at all, or what?
So my favorite phrase apparently is "it depends." So it depends on how high it went up, number one. We can expect your blood sugars to go up a little bit when you eat, even if you do not have diabetes. If you put one of those little glucose monitors on me, I currently do not have diabetes, you will see my blood sugars kind of do this when I eat. That's normal. It should not do this when I eat. And so it depends on how high it goes up. If you tell me I had, a good portion of chips that I was supposed to have and my blood sugars went up by 50 points, that's too high. So then you eat fewer of the chips, so you can still eat the chips but less. The portions do matter. Very good point about mixing it with something else. Straight sugar shot is always going to be different. This is all starch. It's all starch. If you have this with a bean dip, totally different. Your sugars will not do the same thing. It will do a slower rise because the beans will slow down how fast you absorb this. If you have it with a cheese dip, same thing because of the protein. If you have it with avocado, same thing because it's fat. It'll slow down how fast you absorb that. So you can get around what blood sugars do based on mixing it with something else. A bowl of rice is not going to be the same as rice and beans. Different. Your body will process those differently. The way you've cooked something will also make a difference. Mashed potatoes are very different than fries, which are very different than a baked potato. Because some things have already been half processed for you and will get into your system a lot faster, and other things your body has to break down on its own. So those are other things to keep in mind. If you see the rise, it's kind of up to you to decide. Do you like those chips enough where you want to keep them? Okay, then find a way to make it healthier. If you don't love them that much, then get rid of them and eat something different.
There's some magic combinations that people can learn from to not make your sugar go spike like that.
Generally, the combination is to never have a straight carbohydrate, ever. You always mix it with either protein or fat or both. So a very common snack I recommend for people who do have blood sugar related problems are mixing something with a spoon of peanut butter, apples and peanut butter. If you like crackers, that's nice. Have just a couple with the peanut butter. Do not have the straight crackers because that's all starch and it will shoot your sugar up in no time. An apple is great. An apple with peanut butter is better. So if you have something that has a little bit of protein and fat in it, nut butters are great. Cheeses and cheese tend to be okay. They're kind of high in saturated fat, so I don't love recommending them, but things like cheese are also good. Avocados are a nice option. Different types of dips with beans are really good. Cottage cheese is one that some people like. Those will slow down how fast you absorb something else. Hummus is great. Yep, hummus is very good. Those will slow down how fast. So pita and hummus, great. You're welcome.
You said mixed with protein and what?
Protein and a little bit of healthy fat. Yep. Fat does a couple of things. It tells your body you've had enough. Fat is actually what tells you to stop eating. It's one of the reasons why low-fat diets don't often work, because people are still hungry. You actually need a little bit of fat to tell your body it's done. There's a signal in your stomach where once you get some fat in there, it starts to go down and it tells you I've had enough to eat. If you don't have any fat in your diet, you tend to stay hungry. So you want a little bit of fat and protein. It'll help you feel fuller and it will stop your sugars from bumping up. Always. A lot better than just having the straight anything. You try to avoid straight starch at all times.
I always thought putting a protein with a carb would make, yes, the slower, sugar level, but also make the weight stay longer on you. I don't know, I just imagine it's not true.
In terms of digesting it, or?
Like keeping on the weight, because when I eat a salad and
Mhm.
protein, it's very digestible and I don't feel like hungry and it seems, but when I eat a protein with a carb, it seems very heavy.
It is a heavier meal for sure. And you're likely taking in more calories if it's a protein and a carb versus a protein and a salad. Salad has much, because it's mostly fiber.
Right.
Yeah, so you will definitely feel a difference with that. They're totally, totally different meals. one of the things that I often tell people to do is to just change the proportion. What we typically do is we load up on a bunch of starch and then we'll have this tiny piece of chicken next to it. If you can do it, flip that proportion and have a lot more protein and this much rice, and you will still be full, but you don't have as much of the carbohydrate. Same thing that I tell people to do with desserts. If you can get more fruit, have more fruit, and if you still love your ice cream, have a smaller amount of ice cream and pile this thing up with blueberries instead of doing what most restaurants do and give you a ton of ice cream and 2 sad blueberries at the side. You flip it around so that you're still full, but you get the healthier option that keeps you fuller, and you have a small portion of what you still love, so you don't feel like you gave it up, but you're not going to eat as much of it because you're full because of the rest of the plate. Yeah.
For a plant-based eater,
Mm-hmm.
what proteins do you recommend? Because the proteins are so limited.
So for plant-based eaters, typically what you have mostly is tofu and beans. Beans are great protein sources. I'm assuming you also mean there's no fish involved in this whatsoever. No eggs, no nothing. Truly, fully plant-based. So you're looking at, you're looking at primarily tofu, which is essentially beans as well. It's just another form. Or beans in different forms. That's where you get your protein from. And those are all healthy sources. They're very low in saturated fat. It's the reason why plant-based diets are better for your heart. So you can get them in those forms. You can make it in different ways, and that's really where you're going to get your protein from. Some people do end up adding protein powder to their foods, but I don't think it's necessary if you have access to those things. You get plenty of protein from those.
And is 1 cup a good amount in terms of the beans and the protein?
1 uncooked cup, or like,
Yeah, well.
for most people, that's more than enough, because that one cup is about that.
Okay.
Yeah, that's more than enough. And that will usually also give you some additional fiber that you need for the day, which also helps you feel full.
I gotta go. Thank you.
Okay, it's good. I think we're all done. Thank you, guys.
Thank you.